Hi, Mrs. Boyd. My name is Marisa. I'm going to be doing a peripheral vascular assessment today for you. So first thing I would like to do is I'm just going to check your arms. I'm looking at size, I'm looking at symmetry, I'm looking for your vascular pattern, and I'm looking for edema, any lesions, swellings. I'm going to have you lift your arms up so I can check the underside. Very good. I'm looking at color. Go ahead and lay your arms back down there. Very good. I'm just going to check the temperature. Very good. I'm going to test your peripheral perfusion. I'm just going to be checking your nail beds here. Pressing down, I want to make sure that I see a return in color in less than 2 seconds. Very good. Now I'm just going to be, and if we did have areas that were not symmetrical in size, we would be measuring those, noting where we measured so that we could have future reference to notate the dissymmetry. Now I'm going to be checking some of your pulses. This would apply to any of the pulses. If I couldn't palpate them, I could use what's called a Doppler device. We would put a little gel, and I could put the edge, the little ball of the Doppler on there. It would have a cord that would come out with an audio box that we could listen to the pulse. Or we would be assessing for arterial compromise. We would be listening for bruit and whooshing, and that type of thing also. So, and that would apply to all the pulses that we're going to be checking today. So I'm going to check your radial pulse first. Compare the two sides. I'm looking for symmetry and strength. I'm going to test the ulnar pulse. I'm going to test both sides, looking for symmetry and strength. And now I'm going to test your brachial pulse. Test both sides, looking for symmetry and strength. And now I'm just going to palpate for your epitrochlear lymph nodes. Is there any tenderness in here? No. If I could palpate them, I would be assessing for size, texture, location, and tenderness. I'm not finding anything there. Let me test this side. Any tenderness on this side? No. All right. And now I'm going to do what's called an Allen's test, and it's testing for patency for the radial and ulnar side. I'm just going to compress down. If I could have you make a fist. And I'm going to have you gently open your hand. And the palm is pale, so I'm going to release the radial side, and we'll watch for perfusion to come back to the hand. There we go. And then I'm going to press it again, make a fist. I'm going to have you gently open your hand, noting paleness, releasing the ulnar side, watching for perfusion. Very good. Let's test the other hand. Pressing the radial and the ulnar, have you make a fist. I'm going to have you gently open your hand, noting paleness. I'm going to release the radial side, watching for perfusion. Very good. Once again, I'm going to have you make a fist. I'm going to have you gently open your hand. And I'm going to release the ulnar side, watching for return of color. Okay, very good. All right, Mrs. Boyd, I'm going to have you scoot down. I'll put a pillow on your head. And I'm just going to be assessing your legs now. And when we talked about the Doppler earlier, that's a non-invasive and painless procedure. If somebody ever needs to use that, just so you know. All right, we're going to take a look at the legs. Looking at the same thing, I'm looking for color. I'm looking for hair distribution on the legs, shininess, swelling. If I could have you lift up your leg, I just want to look at the underside. Very good. I'm looking for any lesions. Very good. Now with symmetry, if they were not symmetrical, what we would do is we would take measurements in the mid-calf, the largest portion of the mid-thigh, the largest portion of the calf, the ankle, and across the forefoot, and we'd be noting where we measured for future references to remeasure again. So first thing I want to do is I'm going to test the temperature. Very good. And then I'm going to test your peripheral perfusion like we did on the hands. Testing your nail beds, watching for color return in the nail beds in less than 2 seconds. Very good. Very good. And now, Mrs. Boyd, I'm going to be checking for your inguinal lymph nodes. And I'm just going to be palpating along here, and just like the other lymph nodes, if I could palpate them, I would be noting tenderness. Do you have any tenderness in here?
No.
I would be noting size, consistency, texture. I don't note anything there. We're going to check the other leg. Nothing there. All right, now I'm going to test your femoral pulses, and I'm going to have you bend your knee, lay your leg out. So kind of more of a deep pulse. And if we were suspicious of arterial compromise, we would also be using the stethoscope to assess for bruit or whooshing, using the bell of the stethoscope. Okay. And again, this side, bend your leg and out. Assessing with the bell of the stethoscope for arterial compromise, listening for bruit. Very good. And now I'm going to check for your popliteal pulses. I'm going to have you bend your leg. And the popliteal pulse is just lateral to the medial tendon behind the knee. And I'll check the other one. And now I'm going to be checking your dorsal pedis pulses. And I'm looking for symmetrical strength between the two. And then I'm going to check your posterior tibial pulses. And then we also want to assess for edema, for any pitting, if we did note edema for that. All right, Mrs. Boyd, I'm going to have you go ahead and stand up so I can assess for varicosities and thrombophlebitis. Gravity helps to note the varicosities if you have any. And just let me know if you note any tenderness as I palpate along. And I would be noting for tenderness, and I would be also noting for discoloration for thrombophlebitis. Any tenderness in there?
No.
Okay, I'm going to check your other leg. Any tenderness in this leg?
No.
All right. Well, Mrs. Boyd, this concludes our peripheral vascular assessment, and I will document my findings. Thank you.
Thank you.